Acid reflux is very common and may not be a problem unless it causes symptoms or injury to the esophagus. Most people know what it feels like, whether you only have it every once in a while or struggle with it on a regular basis. Today I will be talking about what causes acid reflux and how it is treated in both conventional and holistic medicine. My name is Rachel. I started Holistic Healing Family Practice to help people get to the root cause of their symptoms and heal naturally without toxic medications. In the medical world, acid reflux is known as GERD, or gastroesophageal reflux disease. This is when there is a backflow of stomach contents into the esophagus that causes irritation and other symptoms. The esophagus is the long tube that starts in the back of the throat and transports food all the way down to the stomach. Let's talk about the symptoms of GERD. One of the most common symptoms is regurgitation. This is that bitter burning liquid that climbs up the esophagus and is felt in the back of the throat. The burning is due to the high acid content in the stomach from the hydrochloric acid that is produced to break down food. Another symptom is heartburn, which is pretty much what it sounds like. A burning pain in the chest, right under the breastbone. Abdominal pain can also occur with GERD. This is usually a burning pain in the upper part of the stomach that happens after meals. Though not as common, a few other symptoms of GERD are chronic cough, sore throat, and hoarseness. Now let's talk about what causes GERD. Anything that increases the pressure in the abdomen can have the potential to cause acid reflux. When the pressure increases, the acidic juices in the stomach are more likely to leak out and travel up the esophagus. Increased pressure can be caused by a hernia, or being overweight, or even wearing very tight clothing around the stomach. Another cause of GERD is decreased pressure of the valve that is between the esophagus and the stomach. This valve is designed to open only when a person is swallowing to allow food into the stomach. However, there are certain factors that can decrease the tightness of this valve and allow liquid to flow backward. These are things such as smoking, alcohol, caffeine, certain medications, and some types of food. There are other causes of GERD that conventional medicine does not generally consider, such as food sensitivities, delayed emptying of the stomach, bacterial overgrowth, and stress. Whether you're suffering from GERD symptoms or concerned about the long-term effects, you probably would like to know the best way to treat it. Before you even consider seeking treatment, there are several lifestyle changes you may want to try. First, if you smoke, stop. Smoking decreases the pressure of the valve we just talked about and can cause acid reflux or make it much worse. If you are overweight, it will help if you lose the extra weight because this decreases the pressure in the abdomen. There are some small changes you can make in the way you eat to reduce symptoms. Don't lay down right after meals, and avoid eating for 3 hours before going to bed. Try having small, frequent meals rather than a couple large meals a day. And drink your fluids between meals rather than with them. Make sure you have plenty of protein in your meals, as this will help increase the pressure in the valve between the esophagus and stomach. There are also some foods you may want to limit or avoid until the acid reflux resolves. Alcohol, caffeine, and carbonated beverages such as soda may all make symptoms worse. Some people also have trouble with acidic and spicy foods. Peppermint and spearmint may need to be avoided, as mint also decreases the pressure in the valve between the esophagus and stomach. Other foods to avoid are refined carbohydrates and foods you are allergic or sensitive to. If you have tried making all these changes and your symptoms have not improved, a conventional doctor will most likely start you on a medication. The most common drugs prescribed for GERD are proton pump inhibitors, such as Protonix or Nexium, and histamine receptor blockers, such as Pepcid. These medications are actually not meant to be taken for more than 2 months. They decrease the amount of acid produced in the stomach in the hope of giving you some relief. However, this method of treatment not only ignores the underlying issue, but actually makes the problem worse. As the medication lowers the amount of acid in the stomach, the body thinks that it needs to make more acid. This is why the complete opposite approach actually works a lot better and can cure acid reflux in some people. We'll talk about this method in a moment. If you are on a medication for GERD already, then you will need to work with a practitioner to gradually lower the medication. If you stop abruptly, you will make your symptoms much worse. If you want to find the underlying cause of your GERD and see what type of treatment will work best for you, you will want to work with a holistic practitioner. So, how is GERD treated in holistic and functional medicine? There are several homeopathic remedies and whole food supplements that treat the underlying causes of GERD. The goals of these treatments are to increase the pressure of the valve between the stomach and esophagus, to improve the movement of contents out of the stomach so they don't sit there too long, and to heal and protect the lining of the stomach. It is also helpful to take digestive enzymes to support the body during the healing process. One method of treatment that works for some people is to take 1 tablespoon of good quality apple cider vinegar each morning, the kind that has the mother in it. You will want to dilute the vinegar in a little water so you don't damage your teeth. Take it once a day for several weeks until your symptoms are gone. This doesn't work for everyone, so I always recommend getting tested to find the underlying cause of your symptoms and see what type of treatment will work best for you. As always, I would be happy to work with you and help you on your healing journey.